Hi everyone, my name is Jennifer Navarro and this is my advocacy presentation. Today we are going to meet with Congresswoman Norma Torres from District 35 and her part will be played by my son, Jacob Navarro. Thank you. Thank you so much for taking the time to meet with me today, Congresswoman Torres. Your work protecting families of frontline workers by introducing the Frontline Heroes Act is commendable and appreciated as a nurse in the field.
Well, you're very welcome. How can I be of assistance to you?
My name is Jennifer Navarro, and I currently work as a registered nurse in Kaiser Permanente in Fontana, and I've been an NICU nurse since 1999. But I also am currently a graduate nursing student at Azusa Pacific University, and I have become aware of the importance of my role as a nurse to be a change maker and advocate for my very vulnerable patients, micropreemies, and their families. We can make a huge difference in their lives. So the purpose of this visit is to bring you awareness about families of chronically fragile children resulting from micropreemie births that are less than 23 weeks gestation. We can prepare and guide parents in making decisions when confronted with an imminent delivery. Many families have experienced endless sorrow from lack of preparation to raise a medically fragile child. This creates a moral and ethical dilemma on children's rights, moral distress in the healthcare team and the parents, even marriages and relationships to fall apart, substantial financial burdens on families, and life-changing impacts on society of lifelong disabilities for the children. So I need your help.
Well, what do you have in mind?
Well, currently, parents have no time to make decisions about the resuscitation of their micropreemie child. They are forced to make last-minute decisions, unable to process the tremendous amount of information about the outcomes of a micropreemie birth, such as lifelong disabilities. So one policy change that we need now is to provide proactive consultation of a dedicated clinical ethics committee at the very beginning of all pregnancies during prenatal care, instead of reactive, which is right before delivery. This gives parents ample time to understand the information that is given. Such a committee would have a broad representation that are made up of nursing, advanced practice nurses, medical and allied health staff, maybe staff with legal expertise, an ethicist, and lay members as appropriate. This specific committee can establish the process of resilient decision-making with the parents. This committee's role is to discuss and advise on moral dilemmas in collaboration with the families and the healthcare teams. So right now we currently have obstetricians, neonatologists, hospital ethicists, palliative care doctors, social workers, chaplains, past NICU parents, and current NICU nurses in our practice who already collaborate and are in place in many hospitals. So maybe within the next year and with your financial support, these committees can be developed and be used as a resource for expecting mothers within their first few prenatal visits. Can you take the time to look into this?
I will take the time to look into your concern and recommendation.
Thank you again for making time for our meeting, Congresswoman Torres. I would like to leave you with this information, with my contact if you have any questions and concerns. May I please have your contact to follow up with you regarding this important matter?
Of course, it will be my pleasure. My assistant will provide you with my contact information.
Thank you.
You're welcome.